New procedure in terms of the medical profession, or has this been around and it's just now getting here to this area?
It was the first ones to come out to do this venous ablation was laser mapping, and I want to say it was in the 90s that was developed and utilized, and then this radiofrequency ablation was a more newer procedure, and they both do the venous ablation. We like RF ablation, it's a little cleaner, but as far as historical medicine, it's fairly new. In the last 10, 15 years, it hasn't been done at all.
What's your name?
And it's replacing the venous stripping.
Right.
And the procedure takes, I'd say about 30, 45 minutes. And then after that, we get them up, give them something to eat, something to drink, just to make sure they feel okay. We wrap a compression dressing around them, stocking, make sure they wear their stockings, and then we let them go, and then we have them come back in 2 to 3 days, and we do an ultrasound just to make sure the vein is still closed and that no complications have occurred. So this is one of the most common manifestations of venous insufficiency, which is probably the most widely recognized as varicose veins. So you can see these tortuous, dilated varicosities here of these veins. So you can see all down the leg and the distal thigh. And this is caused by the normal flow of blood should be from the superficial veins through these perforator veins and into the deep veins. And what's happening in these patients is that the valves are not working. And this shows the normal side where the blood is going up towards the heart, and then when the valves close, the blood is unable to go down below the heart. What's happened when you have varicose veins, here we have this dilated vein here, and the valves are unable to close all the way. And so they can't close, so now the blood is refluxing through the valve and down into the vein. This is causing high blood pressure in the veins, or venous hypertension. And so what we do is we place this small catheter into the vein, and we run it all the way up through the leg, and then we emit some heat right into the walls of the vein. You can see the heat is coming out here at the vein wall, and then what that does then is causes the vein to slowly close. And you do that, and so then you move the catheter down here, and you do this segment of vein, and then it closes like this segment, and then we move the catheter down here. And so ultimately you cause this diseased vein that's not working properly to completely close down. It reroutes all the blood through those more healthy veins where the valves are functioning appropriately. Vendors are always very helpful in training our staff and getting us all trained to know how to use it. It's actually a very simple device to use. And we do a lot of procedures that involve putting needles in little vessels, then putting wires in, and then putting catheters in. So the technical aspects for us is actually similar to most other things we already do.
So there isn't